Why is genetic counseling key for cystic fibrosis test results? Imagine learning that you or your child might carry a gene for cystic fibrosis, but not knowing what that really means. That's where genetic counseling becomes so important. It helps you understand your test results clearly and accurately. Cystic fibrosis is caused by mutations in the CFTR gene, and it is inherited in an autosomal recessive pattern. This means a person needs 2 copies of the mutated gene to have the disease. If someone has only one mutated gene, they are a carrier and usually do not have symptoms. But being a carrier can affect reproductive choices because there's a chance of passing the gene to children. Genetic counseling explains how cystic fibrosis is inherited and what your test results mean. It helps you understand that having 1 or 2 mutations can vary in how it affects health. Sometimes, the specific mutations in the CFTR gene can lead to different levels of disease severity. Because the relationship between the genetic mutation and how cystic fibrosis shows up in a person can be complex, counseling helps families understand this uncertainty. It's important to know that knowing your carrier status doesn't mean you or your child will definitely develop cystic fibrosis, but it does influence your reproductive options. Counselors also provide tailored information about the chances of having a child with cystic fibrosis based on your carrier status. They discuss options like prenatal testing or assisted reproductive techniques that can help you make informed decisions. Emotional support is a key part of counseling, especially when facing uncertain or complex results. They can connect you with specialized care centers for ongoing monitoring and treatment if a diagnosis is confirmed or suspected. Another reason genetic counseling is vital is because newborn screening and carrier testing can identify people who don't have symptoms yet. Counseling helps explain what these results mean for your health and future family planning. It also keeps you updated on emerging therapies that target specific CFTR mutations, which can influence treatment choices and outlook. In summary, genetic counseling is essential for understanding cystic fibrosis test results because it educates about inheritance risks, clarifies what the results mean and their limitations, supports informed family planning decisions, and guides follow-up care. It provides a personalized, supportive approach that respects your values and choices. Always remember, it's best to discuss your results with healthcare professionals who can give advice tailored to your unique situation.